everyone, my name's Karina and this is my cat Lilo, and today we're here for our yearly vaccines. Part of the yearly vaccines is a physical with Doc. So, Doc, you want to see Lilo?
Hey Lilo. I'm Dr. Cupcake and I'm going to check out Lilo and see how she's doing today. So the first part of the physical exam is to make friends, and that's a very important part. Put your patient at their ease. Some relax more than others, but now that she seems to be in a good frame of mind to have a physical, we'll begin. Part of what we want to do is look at the eyes, make sure that the eyes are clear and free of any deformity, any abnormality. We're looking at the retinas, we're also looking at how the irises respond to light, and she's normal, fantastic. Then we're going to use this instrument to look into her ears. This is called an otoscope. Oh, she didn't like that very much, so we'll try that again. So what we're doing here is just looking at the ear canal, making sure that there's no mites, making sure there's no infection. And again, real easy, real quick. All you need to do is have a quick look. Finally, in the head part, what we need to do is have a quick look at Lilo's teeth. And the idea there is to look at the upper and lower teeth on both sides. And what we want to look at is to see if there's any evidence of infection, any calculus. One of the things that's been proven in the last few years is how important it is to look after cats' teeth and their dental health. One of the most significant causes of kidney failure in cats is untreated dental disease. Since we started paying attention to cats' dental health, the incidence of cats' kidney disease and liver disease has gone on so significantly. I can't remember the last time I saw a case like that. So dental health is very important. We can talk to you more about keeping a cat's teeth clean and healthy when you come see us. Now we're going to listen to her heart. Part of what you have to do when you're listening to the heart is be quiet. That's why I wasn't speaking to you. Two things we're looking at is the heart pumping at a reasonable rate, and also is its pulse quality good and solid, regular, no arrhythmias. The other issue is lungs. Are the lungs clear and healthy? Do we have any wheezing? Do we have any rasping? Do we have any congestion? And her lungs are clear and her heart is sounding fantastic. Now, as you'll notice, we'll do a little bit and then we give her a break. I think that's a good way to be with cats because they don't like to be messed with for very long. So the idea is we do a little bit, step back, make friends, do a little bit more, step back, make friends, and so on. It looks like I'm just petting her, doesn't it? What I'm actually doing is I'm feeling her limbs, I'm feeling her tummy, I'm feeling her back, I'm feeling her hips, and I'm looking for any lumps, any bumps, any sign of inflammation whatsoever. With her being a young lady, I'm looking to see whether any of her breasts have any evidence of cancer. Cats have many breasts, so basically you have to check every single one of them. There's about 5 pairs in her, so she's free and clear. And then finally, quick look at the butt to make sure there's nothing wrong there either. Finally, we do a dermatological exam. Point of that is to, first of all, look for any evidence of fleas. No evidence of fleas. Fleas do not live on the cats, but what happens is when they do bite a kitty, they leave behind flea dirt. And flea dirt looks like tiny little peppercorn, little pepper shapes, and you can see the signs of fleas that way. The other thing you look for is any sign of hair loss, any crusting, any signs that she might be itching, any signs that she might be wearing off her hair. All those could point towards some kind of skin infection. To finish up a routine physical exam, we always like to examine her stool to look for intestinal parasites. And also, of course, we do check our patients for a microchip the first time we see them. The point of that is to make sure that there is no chip. If there is a chip, next thing to do is to find out whether the chip is registered, because if you have a chip in one of your pets and you have not registered that microchip, you should. Otherwise, it doesn't get her back if you do lose her. At this point, what we do is we ask if you have any questions at all. We will also talk to you about diet. It's very important to know what you're feeding your kitty. Some foods are good, some foods are not so good. We can talk about litter box use, any habits she might have since last year. It's very, very hard to see, as an owner, to see whether your cat is ill or not, and some of the clues as to whether they're ill or not are very, very subtle. Little questions that we ask about whether she's eating normally, defecating normally, drinking water normally, urinating normally, using the litter box normally. All those things are pretty much the only signs an owner has that their cat is not feeling well. So if any of those things change, please call us, let us know what's going on, because chances are, with a routine physical like we just did today, I can pick up on a lot more than you ever thought possible with your kitty cat. Finally, of course, a weight, very important. We check their weight every single time they come in. Cats should have a complete physical every 12 months. You'd be amazed how much your kitty cat's weight will change in 12 months' time. And even a simple matter of weight gain or weight loss can point towards problems. An example, subtle but relentless weight loss in a cat coupled with a voracious appetite can be suggestive of hyperthyroidism. That's not something you're going to pick up without getting a blood test or something to check on their underlying health. Karina did talk about wellness. It's very important to get your kitty cat's blood checked once a year, because even though we've given her a comprehensive physical exam, there's really not anything I can do to find out exactly what's going on with her kidney values, with her liver values, with her thyroid levels, with her sugar levels, to pick up a lot of those subtle abnormalities that cats develop in later life. And once we're done with our physical, of course, we welcome any questions, and we have a chat about any things we can do to make your kitty's life a better one. Thank you for watching.